everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Phentermine. Its brand name is Atti-Plex. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So phentermine hydrochloride produces actions in the central nervous system similar to amphetamine. It does have the ability to stimulate the central nervous system and increase blood pressure. Unfortunately, the exact mechanism of action in the treatment of obesity is still not completely understood. So in terms of indications for use, I kind of mentioned it there, it is indicated to be used in the treatment of obesity. It can also be used in patients who are not classified as obese, but are overweight and have one weight-related comorbidity. Now before an individual was to use phentermine, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated to be used in patients in agitated states. It will be contraindicated in patients who have cardiovascular disease or a history of cardiovascular disease. So this would include uncontrolled hypertension, a stroke, coronary artery disease, arrhythmias, and finally congestive heart failure. Patients who have used a monoamine oxidase inhibitor in the previous 14 days would not be able to use phentermine. You would want to avoid giving this medication to patients who have a history of drug abuse, as well as patients who have glaucoma. It should not be used in patients who have hyperthyroidism. And finally, it should not be used in nursing mothers or in pregnancy. Now, in terms of precautions, we would want to avoid giving this medication to patients who are using other weight loss remedies. It should be noted that in diabetes mellitus, the insulin requirement or oral antihyperglycemic agent requirement may be reduced. Patients should be made aware that there is a risk for drug abuse or drug dependence with phentermine. Primary pulmonary hypertension has been rarely reported with the use of phentermine. And finally, for precautions, it should be noted that valvular heart disease has been reported with the use of phentermine. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use phentermine, they can expect to receive their dose in tablet form or in capsule form. So when patients are using the capsules to decrease body weight, they can use 15 or 30 milligrams once daily, 2 hours after breakfast. For the oral disintegrating tablets, patient would use 15 or 30 milligrams once daily with or without food. Lomaira makes a low-dose tablet, in which case patients would use 8 milligrams 3 times daily, a half hour before meals. And finally, there's a tablet that patients can use. It would come in a strength of 37.5 milligrams, and this can be taken once daily before breakfast or 1 or 2 hours after breakfast. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using phentermine, so I'll go over some of those here now. Some patients may experience stimulation, which may cause insomnia, and xerostoma has also occurred. Some more rare but serious side effects would be heart valve disorders, ischemia, cardiomyopathy, cerebral ischemia, pulmonary arterial hypertension, and finally the emergence of a psychotic disorder. That's all we're going to talk about today with phentermine or Atti-Plex. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.